short paper on behalf of my team, Digital Health Corner, DHC, Improving Occupational Health and Addressing Non-Communicable Diseases Through Workplace Digital Health Innovation. So nowadays, not only in our country, actually in the whole world, we spend most of our time in the workplace. So including women as well, so because nowadays women work in the factories as well as in the corporate office. So actually employee health and well-being integral to efficient workplace. We believe that, and COVID-19 pandemic highlighted the healthy workplace as well. So as like many other LMICs in Bangladesh, due to the limited medical resources and lack of regulatory enforcement in our health, actually becoming we are becoming unproductive in our society, and also we can see the high absenteeism in our workplace. So also in Bangladesh, we can see that inadequate focus on employee well-being and occupational health, lack of inaccessibility of timely care or preventive service for employees. In other researches, we can also find out that about 86% of Americans perform desk job, actually, which resulted less physical activities and causing poor posture, stress, and psychological issue as well. In a study in 2021, we have seen that prolonged computer use leads to CTS and wrist or hand discomfort. Also, in a ILO report, we have seen that workplace diseases and injuries cost globally economy about $1.25 trillion annually. So in Bangladesh, in a study, we have found that about 1,034 people who died due to work injuries in 2022, and also workplace programs are limited mostly in multinational companies in Bangladesh. So not in general in all the workplaces in Bangladesh we get health care services for our employees. In studies, we find that health interventions and at workplace reduces about 33% of employee absenteeism and 20 to 55% of healthcare expenses for businesses. Therefore, to address these challenges, our study introduced Digital Health Corner, that is DHC model, and presents a statistical analysis of the collected data during this pilot study. So the motivation behind our study is to understand the overall health and well-being situation of employees in the workplace, especially focused on women, to introduce a digital health management model designed for both corporate and factory workers in Bangladesh to improve preventive and primary care through digital platforms with focus on both employees and their families as well, to provide recommendations for enhancing workplace health interventions. So our main research questions for this study was three. Number one, how can a digital health solution effectively improve the accessibility and quality of preventive and primary health care for employees in Bangladesh workplaces? Number two was, what are the most prevalent health issues among employees in different workplace settings, like corporate versus factories in Bangladesh? And the third question was, how can technology be effectively leveraged to address gender-specific health challenges and promote greater health equity among employees? So this is our DSC model, where we can see that from factories as well as from corporate office, if we have in each offices, if we have digital healthcare center, again, there need not to be a doctor physically. A simple health worker equipped with our kits and a mobile application will be there to regular screening their health, and our AI system will actually will assess the risk of their health, and based on the output of the system, they can contact with the telemedicine or connect them with the telemedicine service, or can actually connect to the next level of the services. So we have designed or we have deployed our system across 20 companies in Bangladesh with 8,374 individuals, among them 7,553 employees and 821 of their family members took our services from corporate and factory environments for 2 years. Data collected through employees' digital health accounts with real-time access. Data included health measurement and socio-demographic details monitored by CMED Health Limited to ensure quality. Statistical analysis of measurement, for example, BMI, blood pressure, glucose, performed using Python. Odd ratios equipped for NCD's risk factors with data visualization for insights. So we get the findings that NCD and diabetics was the most prevalent NCDs, and men were more get the more diabetics than female, and also factory workers was less diseases than corporate office, because corporate officers, they actually have more desk job compared to factory workers. We also get that NCDs have at least once in every factory types, corporates as well as factory workers. And intervention via DSC showed 73.6 to health improvement, 64.95% medication adherence, and 82.303% of service satisfaction from the employees from the both types. Thank you.
Now floor is open for questions. Any questions from the audience? Yes.
I'm just interested, thank you for the interesting presentation. I'm just interested in knowing that when you're sort of establishing this in factories, is it mandatory for all the factory workers to engage with the digital healthcare system? And if they do and they are screened and some kind of health issue is detected, do the factories have their own compensation mechanisms and funds to sort of help these healthcare workers, the factory workers to sort of work through their health issues? Thank you.
Actually, funding, they actually shared 50% from the workers, 50% from the company. So this was like that if any thing occurs for their healthcare.
And whether all of them are, is it mandatory for them to enroll in the program?
No, it was not mandatory for all the workers. If they wish, they go. Yeah.
Thank you.
Thank you. As we have already passed the time, so we'll conclude the session, and thank you for your presentation.